we thought a good day to have Robert Moffit, a senior fellow over at the Heritage Foundation, a man who has done stints at the HHS. He's seen as one of the go-to guys in this town, or an acknowledged healthcare expert. Mr. Moffit, thank you for joining us here this morning.
I'm happy to be with you, Brian.
All right, so the president says, this is the bottom line. If you want to keep your health care, you can keep it at least for another year. If you're an insurance industry executive, I would imagine when you heard that, your head literally exploded.
Yes, and I think that is the problem. First of all, it doesn't change anything. It simply gives everybody a reprieve for 1 year. So we're back at this mess in October 1st, 2014. We're faced with the exact same thing.
And it's just kicking the can down the road.
Well,
yeah,
no,
after the election.
Well, it's actually before the election, according to
October, excuse me.
Yeah, but the problem is, number one, it doesn't change anything. But the problem is, as you indicated at the opening, actually this does in fact make matters worse in a sense, because what has happened is that the president is saying that all right, it's up to state insurance regulators to allow people to basically buy plans that are incompatible with the statutory language of the Affordable Care Act, which, by the way, is another big issue here. But the problem with all of that is in many states, the cancellation notices have already gone out.
Yeah.
Well, they've already gone out. And look, if you're a businessman, if you're an insurance executive, you run a big insurance company, you've already sent out the cancellation notices. Are you actually going to go through all the trouble of doing a complete U-turn for something that is just 1 year? Or are you just going to say, no, I'm sorry, man, that ship has sailed.
Yeah.
That's right.
Well, I think that's what is going to happen, in effect, because you're talking about a temporary patch on an absolute unfolding disaster. And people are going to look at this, and I'm talking about the insurance, not only the insurance companies, but also the state insurance regulators, and they're going to say, look, this is just simply not going to work. I thought it was very interesting that literally within minutes of the president's announcement, the NAIC, the National Association of Insurance Commissioners. Now, these are basically, this is the trade association of state insurance regulators. They're saying, in effect, that this is not workable. They said that they're saying that creating basically different rules for different policies is going to actually add to the distortions that the administration has already imposed on the insurance market, resulting in even higher health care costs for individuals and families.
Robert Moffit is our guest. He's from the Heritage Foundation. He's expert on health insurance. Let me understand this correctly. Basically, what you're saying is the prices for insurance plans right now have been set based on the assumption that they would be purchased through the exchanges.
Right.
Therefore, they had to set these premiums a certain way. Now, with the president's announcement yesterday, if those old plans are available and made available at those other rates, it's basically going to completely change all of the actuarial assumptions these insurance companies make.
Yeah, they've got to go back and try to basically. What they've got to do, he's asking them to jump in a time machine.
Yeah. Can I ask? Let me put it plainly. Is it possible that the president actually doesn't understand how the free market works?
You're asking the $64,000 question. I think there are two things going on here. Number one, and I say this as a health policy analyst who is kind of a conservative health policy analyst, and I'm a minority within a minority in Washington, as you can imagine. My firm belief is that the guys on the other team, it's not a question of whether or not they understand how the free market works. What I think the public doesn't get is that these guys do not like the free market. They are opposed to the free market. Their argument at the end of the day is that bureaucratic experts should exercise a rational control over this messy system based on their bureaucratic expertise and pristine central planning. That's what they believe in.
Let me ask you this one other question. This is what the president said.
By the way, that's not just an opinion. It's my experience dealing with these guys.
Let me ask this is something the president said yesterday.
What we're also discovering is that insurance is complicated to buy. And another mistake that we made, I think, was underestimating the difficulties of people purchasing insurance online.
Now, people have been purchasing insurance online for over a decade here, Mr. Moffit, and when they're just discovering this now, what does that tell you about the planning process for the implementation of the president's signature policy?
Well, I mean, it's been a disaster. I mean, we spent hundreds of millions of dollars, and on October 1st, it was revealed after the fact, as a result of somebody getting a hold of White House notes, that 6 human beings, living, breathing human beings, out of a country of 310 million people, have actually signed up on the first day of the enrollment. And the enrollment of 106,000 thus far, I mean, he's saying it's progress, and he talked about the fact that 1.5 million people actually accessed the system. But with 40 million uninsured, that's a pretty poor showing.
All right, let me ask you this question, though. I want to play one more cut from the president. Isn't this really what yesterday's press conference was all about?
So what we want to do is to be able to say to these folks, you know what, the Affordable Care Act is not going to be the reason why insurers have to cancel your plan. Now, what folks may find is the insurance companies may still come back and say, we want to charge you 20% more than we did last year, or we're not going to cover prescription drugs now. But that's in the nature of the market that existed earlier.
What he's really saying there is it's not the Affordable Care Act that's the problem here, because we just gave you the fix. If your policy is canceled now, it's not because of us, it's because of those evil insurance companies.
Right. And Barack Obama is a pretty good lawyer arguing an absolutely terrible case. The administration set the rules for the health insurance industry. They forced the insurance companies nationwide to abide by a lot of restrictions that did not allow any significant changes in premiums or deductibles or co-payments or benefits. In fact, under the rules that they adopted in 2010, co-payments couldn't increase much beyond $5, and co-insurance couldn't be increased at all above the level it was set on March 23rd, 2010. So the insurance companies didn't do any of this. The insurance companies did not impose these rules. The administration did. And they just haven't got the guts to take responsibility for what they did. And instead, what they do is what they've been doing since day one, is shifting the blame to somebody else.
Well,
and the good news is it's wearing very thin.
Yeah. Robert Moffit, we thank you so much for joining us here this morning.
Oh, it's a
Robert, one last thing, really fast. Is it insurance or insurance?
It's insurance.
Thank you.
Depends on what part of the country you're from.